Good day. Welcome to day 352 at the EMA office, where we're bringing you the latest in the COVID numbers. Joined here with Chairman Mark Kern, and today we have Sam Bierman from the Health Department. Sam, we're glad you could get a little breakaway from the mass vaccination site and get here.
Thank you. So as of today, we have tested 285,778 St. Clair County residents, which is an increase of 763 from yesterday. And we have 27,990 positive test results, which is an increase of 48 from yesterday. And that does include both males and females from under the age of 10 up to their 70s. And today our daily county positivity rate is 6.3%. And we have 257,788 negative test results. We are adding no new additional deaths today, so we still remain at 445. And for those who have completed the IDPH required 10-day isolation period, we are at 27,009. For state totals, 18,136,253 have been tested, with 1,186,696 positive test results, which is an increase of 1,249 from yesterday. And for deaths, the state is reporting 20,516, which is an increase of 22 from yesterday. For our local hospitalization numbers in St. Clair County, currently we have 50 patients that are admitted due to COVID-related reasons, and 2 of them are on ventilators. Regionally, we have 80 patients that are admitted due to COVID-related reasons, and 6 of them are on ventilators. And we have no changes in our congregate living facility outbreak numbers, so I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll move into the zip code report. 62203, we're up 1 today to 596. 62204, up 1 to 382. 62205, up 2 to 623. 62206, up 2 to 1260. 62207, up 4 to 574. 62208, up 4 to 1,573. 62220, up 2 to 1,995. 62221, up 1 to 2686. 62223, up 2 to 1689. 62226, up 13 to 3,092. 62239 is up 3 today to 451. 62243, up 1 to 744. 62254, down 1 to 785. 62258, up 5 to 1,014. 62260, up 2 to 767. 62269, up 4 to 3,155. And 62285, up 2 to 552. 48 new positives, 763 tested, brings our county positivity to 6.3% today. That brings our rolling average then to 5.3%. Regional positivity remains at 3.9% because Bond County comes in at 0.9%. Clinton is at 0% today. Madison 4.4, Monroe 2.0, Randolph 5.4, St. Clair 4.4%, and Washington County at 3.3%. Question answer today, Herb?
Yes, it is. Question and answer. Before we get started, one comment, John said, I received my first shot today at the fairgrounds. My compliments to everyone that has anything to do with this site. What a smooth running machine. So we appreciate that, John, and for everybody else who's had the patience. Brian, question and answer, and I think today is pretty much the Sam show.
We will give Sam quite a few here.
Lots of vaccine questions.
Yes, ma'am. Your first one says, why don't you turn away people who show up early for appointments?
So we go through the line, and anyone that we determine to be there too early, we do reroute them to help prevent any traffic issues, as to keep them from backing out onto the main road.
The next person says, if I have a vaccine appointment at 11 a.m. and I've been told to show up only a few minutes before, What happens when I show up at 10:55 and the line is long and I don't make it to the checkpoint until noon because I sat in the line? Will I be turned away for being late?
No, you will not. If you have an appointment for that day, that is the most important aspect of it. If you are late because you are sitting in line to get to our first checkpoint, that is not a problem. The main factor is that you have an appointment, and that will be enough to get you through.
Okay, the next person says, I received my first vaccine on February 12th. When will I receive notification for my second one?
So I'm assuming you received Pfizer if you received it from the Fairgrounds vaccination clinic. So that would be 21 days, and you will receive the email approximately 2 days before your second dose is due so you can schedule yourself.
Okay. The next person says, do you know when you will get Moderna vaccine in? I'm due for my second one this week.
So we will be receiving some Moderna, and again, you will be receiving your email approximately 2 days prior to make your second appointment.
Okay. The next person says, how can you go to the 16 to 64 age group when you've not finished 1A or 1B? We applied in early January and have not received any notification, and we're both over 65.
So I'm sorry that you have not been reached out to yet, but if you still have not, by the time you watch the briefing, we have 2 numbers that you are able to call to speak to someone in person, and those numbers are 825-4447 and 509-6010, and those are manned by actually someone on the other end of the line. So if you have any scheduling questions, you can feel free to reach out to either of those numbers.
Okay. The next person says, if I'm registered on the St. Clair County site, is it also helpful to be registered with BJC?
We recommend only being registered at one site, simply because if you register at multiple sites, you could potentially be taking an appointment away from someone if you have already had your appointment at another location that you've had your name on a list for.
Okay. Next person says, will there be mass vaccination sites that allow walk-ups or other options? My son has autism and other medical conditions, and he would not be able to sit in a car for 2 to 3 hours without having a meltdown.
So for ones that are sponsored by the health department in St. Clair County, we obviously have the Fairgrounds, and we also have 330 West Main, which is located in downtown Belleville, right next to the driver's license station. And there are also the options of a Walgreens or CVS, depending on what your needs are. But we do have some locations that are smaller scale, obviously less stimulation for those that require a quieter, more peaceful environment.
So Sam, if they want to make an appointment to be at 330 West Main and drive through in that quieter environment, they would call the line, call the phone number?
Yeah, and still sign up with the vaccine notification form. And when you receive the email, a lot of times there will be options of dates and times and locations for you to pick from if you would like the Fairgrounds or if you would like the 330 West Main location.
Okay, the next person says, if you are with 6 people or more and all have had both shots and it's been after a 2-week period, can we gather for dinner at one of the houses, not social distance and not wear masks?
So at this point, both CDC and IDPH are recommending that even if you have received both vaccines, that you do still need to practice the 3 W's, which is wearing your mask, washing your hands, and still watching your distance.
Okay, the next person says, why are people 65 and older with obesity haven't been contacted, and younger people have been getting shots and they have no health conditions, they're not a health worker or even in that category?
So I can't speak to that question without knowing all of the specifics. But again, if you are someone who has not been reached out to yet and you have completed the vaccine notification form, please reach out to our call center. And again, those numbers are 825-4447 or 509-6010.
Okay. The next person says, what are the criteria for the groups getting vaccinated at this time?
So we have any remaining 1A, which would be frontline medical workers, 1B, which is 65 and older, and the first part of the essential worker category. And then what we are in now is 1B part 2, which is 65 and over, the remaining part of the essential personnel. And then 16 to 64 with health conditions. And those are all listed on the IDPH website on the mass vaccination planning guide if you would like to see what those are specifically listed at.
The next person says, has there been any reports so far of someone catching COVID-19 after they have gotten vaccinated? Is this something they're tracking?
I mean, we have heard of a few, yes, and we are looking at that if someone does become positive in our contact tracing. And please be aware that we, as a health department, are still very vigilant with our contact tracing, and that is still something that is continuing. So when we do speak to someone who is positive, we do ask those questions.
And just because you got a shot doesn't mean that it is an instantaneous
That is correct.
immunization. You don't become immune instantly.
Exactly.
It takes a period of time before everything kicks in your system and the vaccine works.
The next person says, we got our first shot of Pfizer at the fairgrounds today, February 27th. Do we have to get our second shot at the same location, or can we sign up at our hospital or Walgreens?
We do recommend that you get your second vaccination, if possible, the same place you got your first, but it is not required.
Next person says, will the health department send an email with a new code when it's time to sign up for my second shot, or can I use the same link and code that I used the first time?
So you will receive an email with a new code to sign up.
And in that email, it does say this is your second dose notification,
That is correct.
and don't sign up until.
Yes. Yes.
Very important things that we've been
Exactly.
dealing with.
We have seen a lot of people coming to the fairgrounds who have received their second email and they have been too early and they haven't been at that 21 or 28 day mark yet. So yes, when you do get that email, please look at your vaccination card if you have any questions about which vaccine you got and whether you're a 21 or 28 day time frame, and make sure that you take that into account when you're making your second appointment.
So people were being notified that, hey, a reminder, your second shot is coming up. And people took that as, I'll make that reservation for
Yes.
the day. And
Yes.
they still need to remember it's either 3 or 4 weeks, depending on whether you had Pfizer, which is 3 weeks, or Moderna, which is 4.
Yes. Last thing we want is someone waiting in line and getting up to that first checkpoint to realize that they're too early. So, and again, if you have any questions on where you fall with what your dates or which vaccine you received, please reach out to the health department or both of those call numbers, and we'll be happy to answer any questions.
And the reason you'd be too early is because your system needs the full 3 weeks or 4 weeks to be ready for the second dose.
Yes.
That's what we're told.
The next person says, if a person got sick with COVID-19 from the first round of the COVID-19 shot, would it be necessary for them to get the second shot?
So the answer to that is yes. A lot of times when people don't feel well after the first vaccine they get, that is their body recognizing that is something foreign, and they're trying to figure out how to fight that off. So that's not necessarily a bad thing. It's your body saying, hey, this is something that we're not used to. We're figuring out a way to keep it at bay. But yes, if you do have a few mild reactions after the first one, we still recommend getting your second one. However, if you have questions, please check with your individual doctor if you have concerns.
And there's a statement there that says if a person gets sick with COVID-19 from the first shot, just to clarify, the virus is not in this shot.
That is correct.
The shot will not give you the virus. If you develop COVID-19 in the interim, you attracted it from a source outside of the vaccine.
That is correct. There is no live virus in the vaccine that you are getting for COVID-19.
Okay. The next person says, I signed up for the shot, but how can I be sure it went through and will still be there when I come?
So again, check with our call center. Those numbers are 825-4447 or 509-6010.
Next person says, I'll be 65 in a few months, but I have no underlying health conditions. When can I expect to get my vaccine?
So you would fall into phase 2, and it depends on vaccine availability. We are hoping to continue to receive the amount of vaccine that we need to run our mass vaccination site down at 330 West Main, and we're hoping to move as quickly through those populations as we can. But again, it is vaccine dependent, and we have to have the vaccine to be able to give it.
The next person says, I'm on immunotherapy for colon cancer. Will I be able to receive the shot? And my daughter is my caregiver and also lives with me. Will she be eligible for the shot?
So for the first part of that question, you do have colon cancer. Please do check with your doctors and see what their recommendation is on if they would like you to receive the vaccine or not. And for the second part, the daughter that is the caregiver, yes, we just need some documentation from the doctor stating that you are the caregiver and you would fall into the category to be able to receive the vaccine.
Next person says, I got my first dose at the West Main Street site on February 10th. I was told 8 to 10 days prior to my 28th day I should use my original code and go back in and make the second appointment. But then I believe you said on one of your briefings we would get an email about 3 days prior to set up that appointment. Which would be correct?
So it would be the second, so approximately 2 to 3 days before your second dose is due, you will be receiving an email to sign up for your second dose.
Okay, and the next person says, what BMI is considered obese in Illinois for comorbidity? Also, when businesses shut down at the start of COVID, a service advisor at the service department of a car dealership was considered essential. If that was still true, do they qualify for vaccine as they're not able to work from home and are around people all day?
So for anyone that has questions on the specific underlying health conditions that do qualify, I would refer you to the IDPH mass vaccination plan. And the list of underlying health conditions can be found in phase 1B, part 2.
Okay. Does rheumatoid arthritis count as a condition?
Again, I would refer you back to the mass vaccination plan and to phase 1B, part 2.
Now that you're administering both first and second doses, will second dose patients be fighting for the same time slots as first dose patients, or will we have separate dates and times to select from so we actually get in? My 21 days was up last week and I have not even been notified to make an appointment.
So for the second part of that, I'm going to answer the second part first. If you have not received any correspondence from us via an email to schedule your second dose, please do reach out to us so we can figure out what is going on and get you scheduled. But the answer is we do give second doses and first doses at the same clinic. So we can run both at the same clinic.
Okay. The next person says, I'm 70 and I registered in January. I have hypertension and I cannot be notified for my first shot.
Again, please reach out to our call center. The call center is staffed 7 days a week, and you will speak to an actual person on the other end of that line. That is the best way to figure out how we can get you scheduled.
The next person wrote, my son lives in Illinois but works in Missouri at a bar that does not serve food. It's a very popular place with crowds. Does he fall under guidelines to get his shot early?
He would fall under phase 2 unless he had any underlying health conditions that would move him to a higher category.
Okay. The next person wrote, given the large numbers of people getting vaccines, are there any plans in the work to open additional sites?
So as I have said, we have obviously 330 West Main, which is downtown Belleville next to the driver's license station. We also have the fairgrounds, and CVS and Walgreens are also giving vaccine. And yes, the answer is yes, that we hope to have more facilities that are giving vaccine, but it is all vaccine dependent. We have to wait for there to be enough vaccine to be able to distribute it out to other pharmacies.
And the hospitals are assisting with doing
Yes,
that
they are.
also.
Yes.
So there's, through the coalition, the health department is sharing some of those people who have signed up. So you may get notification to go to one of the hospitals to get your vaccine.
Yes.
Okay. Next person says, why can't the QR code and name be matched with the name and the date of a scheduled vaccine be done even if a person shows up early? You have the names and people scheduled.
So we have run into this several times in the past couple days. If you have an appointment for a specific day, that is the day that we have allocated a vaccine for you. So if you have an appointment on Monday and for whatever reason you can't make it on Monday and you decide to show up on Tuesday, we will not have a vaccine allocated for you that day. We take the number of vaccines that we have each day, and that's how many appointments we make. So if you aren't able to make your scheduled appointment, please do not show up on another day that does work for you without speaking to someone to make sure that we can actually get you an appointment.
Well, and it's a logistical nightmare,
It is.
especially with the Pfizer
It is.
Vaccine, because it's a lot more prep to get that ready, and you got to be able to make sure you've got the amount there because it has to be drawn up differently.
And again, we don't want anyone to wait in line if, their appointment was yesterday and we don't have a vaccine allocated for them.
Right.
The next person says, when will the vaccine be available for those that don't have any health conditions?
So that will be phase 2. And again, this is all vaccine dependent on how quickly the manufacturers can produce more vaccine and how quickly we can get it from the state.
Okay. Does the shuttle provided by the St. Clair County Transit District from the Belleville Transit Station to the fairgrounds have a special entrance for shuttles only, or they have to weave through the fairgrounds like the other cars?
No, we do have a dedicated entrance for those buses and our ATS buses that are bringing patients in. They are brought in actually the exit of the facility, and then we have a route for them around so they are not having to weave through the regular traffic.
Okay. Can residential college students living in St. Clair County receive the vaccine if they qualify? Many of them have out-of-state driver's license or could even be international students.
So the answer is yes, as long as we have something, with proof of residency, whether that be, something from the university that they go to or a piece of mail. But yes, they would be able to receive it if they qualify, as long as they were able to provide proof of residency.
Okay. The next person says, thank you for all the hard work. Regarding members of the community who are not internet savvy and not on Facebook, how are these people being notified about vaccine and registration? Is there info such as a phone number they can call to register? Can this info be posted at grocery stores and gas stations to help reach more members of the community?
So the answer to that is yes. We do have a dedicated call center team that is available to speak to anyone if they are having trouble signing up for their appointments. Those numbers are 825-4447 and 509-6010.
Okay, the next person says, great job, everyone, and grateful to have received my first dose at the fairgrounds yesterday. My question is, why can't second appointments be set at the time of the first dose to avoid having to go through the whole process again? My understanding is those that go to the hospitals are given their appointment at the time of the first dose. Thank you, and I apologize if this has been answered before.
So it depends on the scheduling platform that you use. Between Memorial Hospital, St. Elizabeth's, and us at the fairgrounds at the mass vaccination site, we all use different scheduling platforms. So that is one of the reasons that if you did go to the hospital for your first vaccine, you may have received your second date immediately, versus us, who we use a different scheduling software. You'll receive the notification about 2 days before your next appointment to sign up.
And our scheduling software requires that we actually have the dose we're going to give.
That is correct.
Give you in inventory. So obviously, we're not going to have inventory for that shot 3 weeks or 4 weeks in advance, because we're trying to get these shots in arms. So we think we're going to have that dose for you in 3 or 4 weeks, but because we're not keeping that inventory that far out, because we don't want to have it in the refrigerator that far out, you'll have to make your appointment at that close to that 3 week or 4 week date.
And it is important to keep in mind that if you do have your first dose at either one of the hospitals or with us, that if you have questions about scheduling or any specific situations, that you call the facility that you did get your first dose at. Obviously, we wouldn't be able to answer questions about the hospital scheduling, just as they wouldn't be able to answer questions about ours.
Okay.
And I think it's worth mentioning that just because that 21 a day or the 28th day is approaching and you haven't been notified, there's a lot of people that are anxious. The fact, I
Yes.
got to get that second dose, I got to get it. They can go beyond that due date. They just
Correct.
can't go before it.
Those are minimum guidelines. So yes, you are absolutely right. And so, if for whatever reason, if you have to travel for work and you can't get your vaccine till day 30, that's perfectly fine. Those 21 and 28 days are simply minimums.
And you don't need to worry. We will have the vaccine for that second shot. It will be available, so don't worry that you're not going to get it.
We have had no issues with receiving the second doses that anyone has needed.
Okay. The next person says, where does a person age 63 with no medical conditions fall for the vaccine? If it's in that phase 2 with the rest of the population, will invitations be segregated by age? It doesn't seem right that a person over 60 and a person that's 20 become eligible at the same time, when obviously the older person is more vulnerable.
So to answer the first part of that question, someone that is 63 years old with no medical conditions, they would fall into phase 2. And as we've said, that's a little ways down the road yet, but when we do get to that category, we will certainly make any determinations if we need to delineate within that category, to look at obviously who is our most vulnerable, getting them vaccinated first.
Okay. The next person says, I have an easy question. The date for my second dose of the vaccine is going to come and I will be out of town. Will I be able to schedule it when I return? The same is true for my wife's second dose.
The answer to that is yes. Depending on how long you're going to be out of town, if it is a significant amount of time and the original email that you received did not work, if we moved several days down the line and we are past that point, please don't hesitate to give one of those numbers a call. And if we need to send you a new email for a new scheduling link, we'll be happy to do so.
Okay. The next person says, when will you start checking appointment times at the gate instead of 3/4 of the way through the line?
So we are currently doing that. It's deemed, the whole point of that is to keep the traffic off of the main road. And we are going through, and anyone that we deem to be too early, we are asking to leave the line so we can get, traffic flow moving.
And that's happening at the first checkpoint,
Correct.
not 3/4 of the
Yeah,
way.
that's at checkpoint A, which is when you are immediately pulling into the facility itself.
Okay. The next person says, do you know when there will be an app for COVID-19 exposure?
We are not aware of ones that are being used around here. I'm not sure that there are. I'm sure there are some out there, but we aren't aware of them.
And the last question, Sam, for you today says, would you be able to add to your daily numbers how many first and second vaccines are given in St. Clair County and the percentage of the county that has been vaccinated?
So yes, those numbers are available on IDPH's website, but as of today, we have administered 58,099 vaccines in St. Clair County, and of those, we have 13,243 individuals that are fully vaccinated, so that means they've received both vaccines, and that is equaling 5.1% of the population. So we are certainly well on our way.
All right, thank you very much. Chairman Kern, somebody wrote in a comment and says, once again, the Belleville Sportsplex is not monitoring the lack of people wearing masks or social distancing.
So we'll turn that in and have it checked out. We wish that people would comply. We're getting through this, but we're not through the tunnel yet. We've got to get out of this without more infection in the community. We're hearing about all the new strains that are taking hold elsewhere. We don't want that to happen here. So let's all follow the rules, do what we're supposed to. The vaccines are going very well. We've got thousands of them in arms in the county. So all this is going to get us back to normal this summer, but people that aren't following the rules are just going to slow that down.
Okay. And Director Simmons, one final question for today. It says, why are you no longer promoting testing or testing sites? Our testing numbers are way down, and it's no longer easy to figure out where to be tested.
Well, our testing site, the main one in St. Clair County, is still at the St. Clair Mall that we talk about daily, just about, reminding everybody, because testing is still important. Just because we're doing the vaccinations now doesn't mean we lose sight of, as you can see today, there was 48 new cases. So yes, there's testing out there. I think Walgreens is still doing it, but the main one is at the St. Clair Square Mall here in St. Clair County. So if somebody needs to be tested, please tell them that's where they need to go 7 days a week. So the question and answers is over for today. If you are interested in the vaccine, as we tell you every day, the first start to get that process done is to sign up, showing your interest in it. We've had 98,382 of our citizens do so, which is an increase of 877 since yesterday's program. Just go on the EMA webpage or the St. Clair County or the Health Department. That starts the process. We tell you every day, patience is the word that we need from everybody. We're going to get through this, as Chairman Kern says. We can see the light at the end of the tunnel. We've all been doing this, it seems like, for a year. Oh, wait a minute, it's 352 days.
Getting close to a year.
Getting close to a year. And you've all been here with us, Team St. Clair. We appreciate each and every one of you. Please get your shot, and we will be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 353. Have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year. and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.
Buenas tardes, hoy tuvimos a Sam Bierman del Departamento de Salud que nos informó los nuevos casos del condado de St. Clair County, que son 285,778 personas examinadas, con un incremento de 763 nuevos casos de ayer, 27,990 casos positivos, con un aumento de 48 nuevos casos de ayer, hombres y mujeres entre la edad de 10 a 70 años, 257,788 casos negativos, con 445 muertes.